Good morning, ladies. As you can see, my presentation I'm doing is on sexually transmitted diseases. And I think this is a really important topic because even with all of the education on prevention and the new vaccinations and the new treatments available, STDs continue to be on the rise. This is probably because Americans on the whole are really bad at talking about sex and even worse at talking about STDs with their healthcare providers. So a little about STD facts. Sexually transmitted disease refers to numerous infectious organisms that are transmitted primarily through sexual activity. The CDC estimates that approximately 20 million new STD infections occur each year. 2/3 of all STDs worldwide affect people under the age of 25 and 1/3 less than 20 years old. Estimated cost to the US healthcare system is astronomical at $16 billion annually. Excuse me. And most common STD in women is human papillomavirus, otherwise referred to as HPV. The most common STD in men is chlamydia. So this slide is talking about the pathogens that cause STDs. There are three here. One is bacterium, one is protozoan/parasite, and the other is viral. So this slide is talking about the various STDs in the US that are most common. And I've divided them into three categories based upon the pathogen that's caused the infection. So the bacterial pathogen, gonorrhea, syphilis, and chlamydia. As for the viral infections, you have HPV, which is the most common STD in the US. There are several types of HPV virus, and many of them have no symptoms and will cause no harm because the body will get rid of them on its own. However, some of them cause genital warts, others cause infections in the mouth and the throat, and still others can cause cancer of the cervix, the penis, the mouth, and the throat. And fortunately, there are 3 vaccines that are available to protect against these cancers. They are Civarix, Gardasil, and Gardasil 9. And Gardasil 9 also protect against genital warts. The CDC recommends that these vaccines are given to young women and men ages between 11 to 26. And I have actually even heard of children at the age of 9 being given this vaccination. The third infectious pathogen is parasitic. An example of a parasitic infection would be pubic lice. And as you can see, I've got some pictures on here that just show you what the different viruses and bacteria and parasites look like. So there are several routes for the infection to be transmitted. A person can be exposed through infected skin or mucous membranes, such as sores in the mouth. They can also be exposed to infected body fluids and skin through vaginal, anal, or oral sex. There are also non-sexual means, such as blood or blood products. And what this would refer to in general, if you're thinking about blood or blood products, would be transfusions. And I can remember in the 80s when people were becoming aware of this HIV infection and AIDS, that nobody really knew how it was contracted, how it was transmitted. So there was a lot of fear in society in general about it. I mean, people were wanting to stay away from anyone that they thought might be infected with an HIV, and it just caused a lot of trauma for the people that did carry that diagnosis. But later on, it was found that, because originally it was thought that this infection was spread through homosexual relationships, but later on it became known that it was also blood products and blood were causing the infection. People who were getting transfusions But now today, there is actually a very, very low risk of this happening because of the rigorous testing that they do on the blood and blood products before they're given to people. And then the scariest way of transmission, as far as I'm concerned, is that genital herpes, syphilis, and HIV can be passed to babies during pregnancy, and it can result in stillbirth, neonatal death, brain damage, blindness, and deafness. There are several diagnostic ways of testing for STDs. Blood tests can confirm the diagnosis of HIV or the later stages of syphilis. Some STDs can be confirmed with urine samples. We can also, a lot of times, a physician or a nurse would want to do a physical exam, checking the genital area to check for warts, sores, rashes, irritation, or discharge. And then the healthcare professional will also take a sample of fluid from any sores or blisters that may be on the genital area. So this slide is talking about treatment. So the treatment is going to be dependent upon the pathogen that the STD that has infected a person with an STD. And bacterial infections are treated with antibiotics, and often in a single dose. I mean, sometimes a single dose can just cure many sexually transmitted bacterial and parasitic infections, including gonorrhea, syphilis, chlamydia, and trichomoniasis. And typically, if you'll be treated for gonorrhea and chlamydia at the same time, because the two infections often appear together. Viral STDs are treated with antiviral drugs, such as, which are a class of medication used specifically for treating viral infections rather than bacterial ones. And then lastly, we have antiretrovirals, which are used to treat HIV positive people. And this therapy is used to reduce the amount of the viral load in the blood and the body fluid. And actually, this therapy can keep HIV positive persons healthy for many years and can greatly reduce the chances of transmitting HIV to their sexual partners if they take their medication consistently. So on this slide, I've separated the STDs between the ones that are curable and the ones that are not curable. And you can probably notice that the ones that are curable are the bacterial infections such as syphilis, gonorrhea, chlamydia, and trichomonas. And the ones that are non-curable are the viral infections such as herpes simplex, HIV, HPV, and hepatitis B. Unfortunately, even though the viral infections are not curable, the symptoms can be greatly reduced or modified through the treatment that's given to them. I put this slide here on HIV in particular because I think it's pretty exciting what's happening with all the treatment for HIV now. I know 30 or 40 years ago, if you were diagnosed with HIV, you were pretty much given a death sentence. But because of the development of the antiretroviral medicines, many people are living with HIV and experience minimal adverse health effects at all. As I said, the effective treatment can reduce the level of the viral load in the person's body. And when that viral load is so low that the test cannot detect it, people can no longer pass on the HIV as long as they continue to take their medications. When looking at prevention, there are several ways and approaches that can be taken. And one would be vaccines, which can be given currently for HPV and hepatitis B. These vaccines are safe and effective, and they are recommended to prevent both hepatitis B and HPV. And then you can also practice safe sex. You can make a commitment to mutual monogamy, practice avoiding alcohol and drug use. Screening is very helpful, as well as education, which is something that as case managers, we will be doing a lot of. So talking about STDs in relation to mental illness, it has been found that individuals with psychiatric disorders are at a very high risk of, or much higher risk for STDs than the general population. In fact, in the United States, the prevalence of HIV among patients with psychiatric illness is 10 to 20 times higher than that in the general population. Factors contributing to the increased vulnerability is impaired autonomy, increased impulsivity, and increased susceptibility to coerced sex. So lastly, I want to talk about the role of the case manager. I thought about this, and there were several things that I identified that would be important as case managers to do with clients. And one would be to assist the client in adhering to their medical appointments and their treatment regimen. Would also be important to collaborate with other professionals in the community for the needed services. It would be important to assist the clients in adhering to their medication, especially those who are HIV infected, because as I say with antiretroviral therapy, it is actually a daily routine that they would have to take daily. They would have to take their medications probably for the rest of their life. And then lastly, we would educate the clients on how to reduce the risk of infection as well as transmission. So that's all I have. Thank you very much.